Good morning. Dr. Liz here, doctor of acupuncture and oriental medicine, where life becomes better living. Today's topic, depression. A little bit about depression and anxiety today. So, almost 10% of Americans seem to suffer from some type of anxiety or depression. More girls than boys. Over 10% for the girls, and over 6% for the boys. So a lot of people are taking antidepressants. And this is why we're going to talk a little bit today about that. So yes, antidepressants are drugs that act on specific brain chemicals, which are supposed to regulate your mood, and commonly they do. Commonly prescribed medication in the U.S., according to the American Psychology Association, is first being analgesics, which helps deal with pain, typically, historically. And the other types of antidepressants that are commonly used are SSRIs, SNRIs, and DRIs, tricyclics, and MAOIs, to name a few of the common ones used and prescribed to many of these 22 plus million people here in the United States of America. So, wow, sounds like a foreign language, people say to me. Got that. So please tell me about the most common type of antidepressant. So sure, I bet you've heard of Prozac. And Prozac is an example of an SSRI, and which stands for selective serotonin reuptake inhibitor. And Prozac and Zoloft are examples of such, and they work by increasing the levels of the serotonin in the brain, which is a neurotransmitter which is made of protein. So the brain making more serotonin available is the function of those particular SSRIs. So an SNRI example would be like Cymbalta. And the SNRI involves norepinephrine and is related to alertness and energy, and SNRIs work in the sense that they block the neurotransmitters. That's what they do. That is their function. The SNRI blocks it. It blocks specifically the serotonin and the norepinephrine from going back into the cells that release them. So that's what their function is, ladies and gentlemen. Wellbutrin is an example of an NDRI, and NDRIs are another choice if you're depressed or have anxiety, and they involve the dopamine and the norepinephrine. Dopamine and the norepinephrine are involved when you're taking an NDRI, such as Wellbutrin. These are fairly common ones that I'm mentioning here today, just touching the surface. Tricyclics and MAOIs are not any longer commonly used due to some of the potential dangers that patients were experiencing, and which included side effects and plus interactions with other types of medications. It's happening too commonly, so they nip that in the butt for the most part. So people ask me, do antidepressants even work? And the question is, studies show that pertaining to mild to moderate depression, they do work, but only as effectively as a placebo. And placebos do work. But for someone with an extreme condition of depression, antidepressants are found to be effective. But if you're one of these people that's sort of borderline mild to moderate, exercise can be helpful for you too. And mild to moderate depression and eating fruits and vegetables really does matter. or rainbow type of diet. That's why I wore this just for you guys today. Rainbow foods, grapes, kelp, greens, all kinds of delicious balanced diet with lots and loads of antioxidants, good for the brain. So I don't actually recommend eating fish for depression, but lots of fresh, organic fruits and vegetables, rich beans that contain a lot of folate, loads of greens cooked in your soups, at your Thai restaurants, or however you want to cook it in your kitchen. So the mercury content in the fish is why it could possibly be not overly positive with mental health disorders. So if you know it's fresh and it's been tested, then I think it's fine. But generally, mercury, more and more mercury is being found in the fish, so I would try not to eat too much of that if you have a struggle with a mental health issue, because the mercury is found to not be positive with folks that struggle from depression. So basically, studies show that if you suffer from mild to moderate depression, you're better off exercising. Even just take a walk. Take a walk in the park. Look at the greenery around you, how lovely it is. Green stuff is good for the liver, and it helps move the chi in our body, which helps us become less sad. It's healthier for you than even walking the beach. But you can do both. You can do both. And also, you eating really healthy, exercising, surrounding yourself with nice, green, beautiful things, eating a balanced diet with all different colors in it, orange and yellows and greens and fruits and vegetables that are rainbow-like, really healthy for the brain, and peanuts and all kinds of yummy things, nuts and seeds. The other thing that you can do is talk to someone, and acupuncture. Did you know acupuncture is extremely useful and helpful for a lot of mental health conditions, including anxiety, depression, even PTSD. We use the ear. See the ear, folks? We do auricular medicine on that. Helps very anxious people. Oh my gosh, does it work well. So there's some ideas, and also an anti-inflammatory diet. Yep, it's another good choice, which is kind of the items that we already mentioned. But exercise, walking around, surrounding yourself with nice green surroundings, eating like a rainbow vegetable diet, thinking happy thoughts, go talk with someone, and getting acupuncture and auricular therapy. Thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Jusqu'à demain.